Welcome, Deanna, to the Life Ability Podcast. Thank you so much for joining me today and supporting my mission of reaching the wider audience and allowing them to explore and embody various strategies so that they can have an improved quality of life. So, I'd love for us to start off with you telling us a little bit about yourself as an occupational therapist and what led you into zero balancing.
Okay. I am in the United States in Indiana, and my husband's also an OT. So he became an OT several years after he met me and we got married. I have worked pretty much the whole gamut of OT over the years in different areas, rehab, hand therapy, and then I discovered a bodywork technique called zero balancing that I fell in love with and have been doing that and now teaching it. And it's a wonderful technique that just helps balance your whole being. I like the fact that it's based on Eastern medicine techniques. And so I have a private practice now and enjoy helping people to problem solve and look at maybe some of the chronic issues, health issues that they have that haven't been solved with traditional medicine, and seeing if we can find some of these integrative health practices that we can use to maybe help change the trajectory of people's health and wellness.
Very interesting. And can you tell us a little bit about what zero balancing is for, some of our listeners that probably don't know about it?
Right. So the technique was developed in the 70s by Dr. Fritz Smith, who's actually having a birthday this weekend and turning 95. He's still alive. And he is an osteopathic physician, an acupuncturist, and a rolfer. And so he came up with this idea of how to basically teach the acupuncturist how to work with the structural body. They knew a lot about the energy body, but he wanted them to help understand the bones and the joints and how that influences the energy body. And so came up with this technique. And his wife, Dr. Amina Rahim, took some of those principles and then used acupressure, the Jin Shin Jitsu protocols and processing dialogue from her transpersonal psychology background, and created something called process acupressure and clinical acupressure, which I also teach. And so the two of those combined have been like a yin yang type of treatment approach for me. I like the zero balancing because it's a very simple one protocol. It takes 30 to 45 minutes to do on a person. It can be performed with your clothes on, which is very nice. For a lot of people don't feel comfortable taking clothes off for a massage. The downside is you have to go to somebody that's trained in it to receive it. Whereas the acupressure, I can teach people different points to hold by demonstrating. I can teach people online, and when they use the acupressure points on themselves, it helps in a very similar way to balance their body's energy systems to feel better. And so I like the combination of both, where I can treat people, but I can also empower them by giving them acupressure points to hold to help them feel better.
Amazing. And so if a client walks into one of your sessions, what are some of their expectations that they should be aware of in terms of the physical environment?
I usually let them know they're going to be fully clothed. We have a conversation about their current health history, what's going on physically, mentally, emotionally, spiritually, what's happening with digestion and their stress levels. And then we come up with some goals they want to accomplish in their life. If they had more energy to do things, what would they like to do with their day? And then we set the intention for the session, and they lie down on the table, and I hold a series of points on their body, and they get very deeply relaxed, almost like they're falling asleep. And I think that's, to me, part of the beauty of this work is that they get a chance to have quiet and stillness. And so many people are stressed out, they're rushing around, they're constantly having noise in their life, with radio or TV or people. And that chance to have quiet is a reset for them. And their body relaxes. I think from a vagus nerve perspective, it's resetting a lot of those fight or flight responses to rest and digest. They breathe deeper. I hear their tummy start to gurgle. I know their digestion is improving. I see the muscle relaxation in their face. And so when they get up from the table, they not only physically feel better, and they can move easier, and they also just feel lighter. They feel happier. And the feeling lasts for several days, which is also kind of surprising. I don't always feel that after other types of body work. So it's deeply relaxing, and it feels like their body is moving towards greater health and wellness. And it often helps jumpstart them to healing in other ways.
So if you were to, I guess, go into a little bit more about zero balancing and maybe differentiate it to other modalities like kinesiology or Reiki, how would you describe zero balancing in comparison?
So some modalities like Reiki are working more with purely the energy, maybe the chakras, the aura of the person. Sometimes they don't even touch the person. They're influencing the flows of energy to bring balance to that. In zero balancing, we're working at the bone level. Now, a chiropractor would work at a bone level too, but manipulating the bones to be in position. Here, we're just touching the body at the bone level and some of the major joints by creating a little bit of tension, like at the hip, maybe a little bit of tension there. And what happens is that there's a piezoelectric current in the bone that is activated because of the crystalline structure. And so this vibration and electrical charge in the bone helps to move through the bone and improve the function of the bone. So the bone is where we make our red blood cells. There's a lot of hormones actually within the bone that interface with the body's system of stress relief. So the oxytocin. And so that by touching the bone at the deepest level, it helps to activate this electrical charge. And so we start to heal from the inside out. We know in our bones before there's, danger, we have a sense or an intuition, and it's this deepest level. The bones carry our memories. They hold our history. And so when we touch a person at the bone level, they feel deeply met. And we also are helping to kind of stimulate the body's ability to return back to its natural state when we were first born, all those newborn baby cells.
And so I guess for something like kinesiology, where you used the muscles to see if there's a stressor in the body, is there a similar technique that you would use in zero balancing to find out what to work on?
Well, obviously we are working through the muscles, but our focus is actually on the bones and the joints along the spine. So we're looking at the bones that function as a unit. You can't isolate out a single bone in the spine or in your feet or in your wrist. And so we're focusing on that. I'm not necessarily using muscles to do testing or movement, but I'm feeling for where that tension is, of where the muscles are attaching to the bones, to the joints, and then helping release the tension at that level. And then that actually allows the greater ease of movement in the body. Does that answer your question?
Yeah, that's very helpful. Can you tell us a little bit, or even give us some, maybe success stories that you have experienced working with people that have had chronic health conditions?
Um, Probably one of the more dramatic persons that I worked with was a young woman on the autism spectrum who had a lot of chronic migraines and was being challenged to keep up with her schoolwork. She was taking college level classes and pulling D's and F's, really having difficulty with that. And so we started working with her, and I taught her some acupressure points and some tapping to help her keep her energy flows moving in between the sessions. And she started improving her grades. She started pulling A's. She was able to concentrate better in school, and some of her digestion issues were resolving. She started going to yoga and did seem to be thriving in school, and her migraines got better. She could tell once one was coming on, and instead of having several a week, she would just have one or two a month, and those would be very mild. I was kind of surprised during all of COVID, I did not see her. And she was able to do a lot of her own self-care using essential oils and the acupressure and the yoga, and keep herself healthy. And so that's what I feel like the zero balancing helps me to get people over the hump, to help jumpstart the trajectory towards wellness. And then if we can come up with a home program for them that is doable, that they can follow through with and keep that healthy energy moving in their body, then they feel better and seem to get better from the chronic issues that they've had. The other thing I would say is, me personally, I have had Lyme disease in 2009, and that's part of what started me on this learning about different integrative health practices. Is I wanted to find alternative ways to address the conditions that I was having, the autoimmune, the pain, the achy joints, the fatigue. And so starting out with essential oils and trying different practices, when I found zero balancing, that was what helped me the most by rebalancing my flows of energy in my body. And so my body started to feel better from that. So yeah, I think there's a lot of people that have been helped, whether it's back pain or I see quite a few people who have various symptoms related to stress, including digestive issues and sleep disorders. And so when they get these flows of energy balanced in their body, they feel better, and then they can sleep better. Their digestion tends to be better because they're not dumping all those stress hormones into their body's systems. I have worked with some children too that a lot of times with ADHD or even younger children, little colicky babies, sometimes newborns have a lot of the birth trauma from coming through the birth canal. And so I do a little bit of craniosacral therapy, but I find the zero balancing actually seems to work just as well. And so I like to use the techniques with children and even infants. So all ages can benefit from this work.
And that's the beauty about integrative approaches, isn't it?
Yeah.
It's you just understanding that it's a multifaceted approach, but you can use it for any specific age group or condition. Amazing. You previously mentioned that, for someone to engage in a technique like this, they have to go to a professional that has an understanding and awareness about zero balancing and some sort of training, I would assume. But if someone who is currently really bogged down with their chronic health condition and just wanting to find some sort of relief, is there any way or any acupoints that you can recommend for them to start this process? And then what's the best way for them to find someone who's trained in zero balancing?
Okay. What I would say is I spend a lot of time talking about the vagus nerve with my clients and the stress response. And so the very first thing I teach people is to breathe. Whenever we take a deep breath, it lets our body know we're safe. And that seems to start that relaxation response. So I usually teach them the acupressure point on their collarbone. Underneath, it's kind of in nipple line or bra strap line. And they can hold the point either with two hands, or I use a thumb and a middle finger and just put on my chest and hold the point and then do some deep breathing. So breathing in and then breathing out. And I've discovered that it's not always helpful to teach people breathing techniques by counting. Those people with anxiety, often that stresses them out even more. And so I like to just teach them to hold the acupressure point and notice their breath expanding and then contracting. So breathing in, and then when they're ready, just exhaling. And then I also encourage a whispered ah where they're opening their jaw and relaxing it. So at the end of the breath, to end with a so breathing in and then breathing out with a whispered ah at the end. And having people do several of those really seems to help reduce the amount of stress. And the other favorite point I like is at the base of the little finger. If you follow the little finger down to your wrist, it's kind of on the inside of the tendon. There's a point called Heart 7. And this point is very good for anxiety, and it helps to slow the heart rate whenever you have like public speaking or something startles you and you get that energy rush. That point will help to calm the heart rate. And it's actually a point you can use if somebody's having a heart attack or having some health issues to be able to hold that point. And it's nice to hold it at times when you go to bed. If you can figure out how to hold both points with your hands crossed, and it helps you to then be calm as you're laying there breathing and helps you to fall asleep faster. So that's another good point to use.
Great. So that's starting off with the breath and using the lung alarm point and the Heart 7 you mentioned.
Yes.
And just do you just recommend them to give it a bit of a rub or to tap it? What do you recommend?
Oh, that's a good question. So in our technique, this is called stomach 13, this point here under the collarbone. And if you kind of squeeze your finger in a little bit and take some of the looseness of the skin out, you're kind of curving in a little bit. And that is part of what helps to activate the point. Some people like to tap the points. You can put your thumbs together and tap your hands like this, or tap here, or curve in. But I like to take a little bit of that looseness of the skin, the tissue out, and then just relax my hand and soften it. So you don't need to use much pressure. I call it light touch is one way to think of it. And then you want to soften your hands. You feel the sensation of having your finger on a stick of butter, and when you just hold the finger, it starts to melt. So that melting sensation of something melting under your fingers is what we're looking for. So I didn't answer your other question about finding a practitioner. There's a Zero Balancing Touch Foundation. It's zbtouch.org. And it's an international organization. There are zero balancing organizations in multiple countries around the world. There is Spain and England, Switzerland, and New Zealand and Australia. So you can find the organization on there and find out if there's classes and also find a practitioner. So that's a good place to start if you're interested in finding more about the zero balancing. There's a lot of people online who are teaching acupressure classes, and so you can often start there. The organization that Dr. Smith's wife formed is now called Insight Acupressure. And so insightAcupressure.org is another place you could go to find some acupressure information. So those would be two places to start.
Amazing. Well, thank you so much, Deanna, for giving us a little introductory to zero balancing and helping us understand what an effective technique it is for people that are experiencing chronic health conditions ranging from, a wide variety. I'd love to finish off with asking 3 questions that I discuss with all my guest speakers. The first one being, how would you like to see the future of holistic health and well-being?
Oh my, I would like to see insurance companies reimbursing that and that it's available for everybody to be able to use as a form of healthcare.
Yep. Second question being, what's your favorite occupation to engage in? And for our listeners, occupation being any activity that you either do on a day-to-day basis or anything that you engage in.
Oh, so I actually love creativity. So I would consider this under play and leisure is to do some kind of creative practice every day, whether that's artwork or music or something that just makes your heart sing.
Amazing, bringing joy back into that heart space.
Exactly.
I love it. And the last question being, what are 3 resources that you can recommend to someone who's wanting to change or start that process of the journey, but don't know what to do or where to start?
They can always start with some of my classes on my website. I'm thinking learning breathwork techniques is very important. Essential oils. I think there's a lot of essential oils available to people, even with people who might be not open to certain scents, that they often are able to tolerate some essential oils. And I love acupressure. I think learning acupressure points is important for people to help with their own health and wellness. So finding resources online, when you Google or search for those, I'm not sure what in Australia you would use, but on the internet you can find all kinds of wonderful resources. So yeah.
Amazing. So that's breath work, essential oils, and acupressure points.
Those would be my top 3, yes.
Yeah. Amazing. Thanks so much, Deanna. If people want to find out a little bit more about you and your offerings, where is the best place to do that?
I have a website. It's dwaggy, DWAGGY.com, or I have a Linktree site that's linktr.ee and then /dwaggy. Either of those get you to my website. Actually, I know if you search for my name, it'll often come up. So you're welcome to have people search for me there. And if people have questions, I'd be happy to pass on information. I know there's a zero balancing training coming up in Australia in January of 2025. So hopefully if some people are interested in the training, that would be a great place to check out.
Amazing. Thanks so much, Deanna.
You're welcome. Thank you so much for hosting me. I appreciated it. And